My Mogato Yokar. A warm welcome to each and every one of you watching the CCR TV program. And this is an exclusive program on Tumchi Bolaiki, Tumchea, Hatant. Simply it means that your health in your hands. We have been talking about Alzheimer's, dementia, and that this is rising in Goa, all over the world also. And we had our expert, a professor and head of the neurology department of Goa Medical College, who has done her post-graduation in neurology from the PGIMER, that's Postgraduate Institute of Medical Education and Research in Chandigarh, which is India's premier postgraduate institute. She's an MD in general medicine, having gone through the portals of our Goa Medical College for MBBS. Her special interest is in cognitive disorders, movement disorders, inflammatory disorders of the nervous system. Welcome, Dr. Teresa Ferreira. And our usual guide for us, who initiated this program, our Professor Wiseman Pinto, who has recently been elected as the president of the South Asian Academy of Cytopathology and Histopathology at Colombo, Sri Lanka, at the 50th Anniversary International Conference of the College of Pathologists at UCFM, University of Colombo, Faculty of Medicine in Colombo. My Magaso Yokar, Dr. Wiseman.
Thank you.
Dr. Teresa, you have been throwing light on this neurodegenerative problem of the brain. And it is not something associated with the old age, but sometimes it happens now in youngsters also. And we talked about dementia being the umbrella for Alzheimer's. Lot of questions that I was asked personally to say that is it possible to detect this for a lay people at home, to say that looks like that you may have a problem, and if they are empowered, they would definitely come to the professional help that you could then take over.
What are the features which can be recognized early by family members or people who are closely associated with an individual, or by the individual himself? So, one is, of course, if the individual is tending to forget, not remember recent events, recent things which are told. So, it is like suppose an individual is asked to pass a message to someone in their house, say a phone message, when the person is in the house and a phone call comes and asks to pass a message, and the person completely forgets, and it does not even, and he cannot recollect it, or he recollect and it has to be something which is a little significant to the individual. Many a times, because of lack of attention or not wanting, some people may forget, but here when this is happening more on a regular basis, it is something to worry about. Second is when there are changes in behavior, an individual becoming aloof, not interested in the activities which used to usually interest the person, in which the person would take either pleasure in doing certain activities or would do certain activities on a regular basis, and when the person starts losing that interest. Like last time I mentioned, the onset of a depression, a depressed mood in an advanced age, in a person who has never had a depression earlier, again may be indicative of onset of certain of these kind of neurodegenerative disorders like dementia. Then sometimes it may also come in the form of inability to recollect names. So, the recollection of names might be a person may not forget names of items, but names of people, names of places, that might become difficult for a person to recollect. So, either the individual will realize that this is happening to them, or it will be the family members or someone who is closely associated with an individual which might realize certain these features. Now, there are other types of dementias where certain other features may come, wherein people sometimes can lose vision. Those are rarer types of dementia. Sudden onset of a loss of vision, certain onset of inability to do tasks in spite of having a full normal, they forget, they cannot do certain activities. They forget how to, say, use their shaving machine, which they have been using earlier, how to use a microwave, which they have been using earlier, how to use a mobile. It is not that when expecting an elderly person to learn a machine anew, it is they already knew it and now they fail to do something. So, those are also certain, can be associated with the onset of dementia, can be features.
Somebody asked me, says at the initial stages for lay people, that they could sometimes assess the mental state through the so-called, I don't know what it is, but 2-finger test to detect early signs. What is it?
So, these 2-finger tests is a form of, it's one of the tests that we also use. It's a modification of a test that we use to test something called as anapraxia. So, anapraxia is a higher cortical function. It's a function of the nervous system, of the brain, where in spite of having all the strength, having your normal senses, having your normal coordination, means when you are able to coordinate all your movements, you are still unable to carry out a particular function, a motor function. So, it can be a complex function like you asking a person, how will you light a candle? You have a candle over here, how will you light it? So, there is the person takes a match, lights it, and then he knows the steps. So, take the matchbox, strike the match, and then go and light the candle. So, there is a procedure.
Yes.
Now, the 2-finger test is a simplified version of even this, wherein just with the fingers you ask the person to either demonstrate how do you do the victory sign. First, you can just ask the person how do you do the victory sign. So, whether the person is able to do this. So, the person, you are already testing memory also there. So, you are asking person should be associating it, victory sign is this. Now, if a person can't understand that, can you do this? And if a person can't replicate that, which can also happen in dementias. It is definitely seen in dementias, seen in Alzheimer's dementia, but at what stage of the disease varies for person to person.
Yes.
So, if it is negative, doesn't mean it is not dementia.
Yeah.
But
So,
if it is there,
that's what this person told me.
Yeah.
If we are empowered, educated to do this, then there is need for further professional evaluation.
yes,
Which is needed.
Yes, then we have to have a detail, because apraxias can happen in other conditions as well. You may get an apraxia as a residue of a stroke which the person has recovered.
Yes.
So, an apraxia doesn't mean dementia, but it definitely one of the signs.
Yeah,
of
but
a
then you go
neurodegeneration.
to the professional.
Yes.
So it eliminates, the doubt, and then it tells you, looks like there is a problem, you better take care of.
Yeah, it gives you a little bit of a stronger feel so that you really take the help.
Yes.
But most important is that history, the history of and knowing that something is not fine.
Yeah.
With that person.
Yeah.
When we talk of Dr. Wiseman,
Yeah.
they say that there are specialized brain scans now called PET scans, and they have been developed to study both the proteins, your amyloid and tau in the brains. Is it the right thing?
So, Mr. Jovito, as Dr. Teresa will also tell us, first thing we see the clinical aspect of the patient.
Yes.
Second, we do the, as you rightly said, imaging. Imaging will be MRI, CT and PET CT, which is functional to see the tau and the amyloid.
Correct.
Now, in addition to that, they used to do CSF examination of this ratio, amyloid and tau. But now, tests have developed by the Lumi pulse, you can do from the blood.
Yeah, for phosphorylated tau.
Before, from the blood, the ratio of amyloid and tau, and you can come to a diagnosis. But important thing is that we have to see the clinical correlation with this test.
Are these tests being done available in the GMC?
Yeah, so at the GMC we do MRI and CT.
MRI and CT.
Yeah. So in dementia, it is always better to have an MRI. MRI does not give you the diagnosis. Okay, it is the clinical examination and the history that will guide you better than an MRI. The MRI is to support our clinical suspicion. So, in the MRI, what we are looking for? We are looking for whatever we are finding on examination, the areas of the brain which we are seeing are getting involved. Are we getting an MRI correlate? Is the brain looking shrunken in that area, or is there a tumor in that area? Sometimes the tumor may also cause a similar symptom. Is there another disease in that area which we can intervene and we can correct it and remedy, and can the person recover? So, the MRI has got multiple reasons to do. It is one, to support your diagnosis. Second, to find out things which you may miss. You may not be able to diagnose a tumor looking at a person's face, but you may be able to see it on the MRI and see whether you can cure the person. And of course, there are patterns of involvement which guide us into also telling which neurodegenerative disorder is likely the patient is suffering from.
Mostly for Alzheimer's, it is the cortex. It starts in the hippocampus, but it is the frontal, parietal and temporal. And there is atrophy of the brain later on and hydrocephalus. Now, the causes of dementia, we are talking of Alzheimer's in general and other causes also. First is the age. It is totally related to the age.
Yeah, when you look at Alzheimer's, definitely, exponentially as
the age. Second,
but nothing to do with the old age. It happens at advanced age.
Yeah, as you grow older.
As you grow older.
And you know, the figures in the world, there are 55 million. There are in US about 8 million, 7 million. In India, 8 million. Goa is quite high.
Goa, Dr. Teresa, you have been now for how many years in the Goa Medical College?
14 years.
14 years.
14 years.
So, in this 14 years, what has been the progression?
We definitely see a larger number of patients of dementia coming. Means compared to when I joined to today, definitely the number of patients is increasing. But I only also see that I know that what we are seeing is only the tip of the iceberg. Because because what happens is these patients are elderly. Access to coming to the hospital is sometimes difficult. It is difficult for them to wait for long periods. Sometimes they cannot, they have got, a lot of these patients have got, by the time, like last time I said, sometimes they are mostly found at an advanced stage. So, they are already having behavioral problems. They cannot wait. They are restless. So, all these are issues which I know that there are a large number of patients which we are not seeing. They are also being seen by private neurologists, which is good. It is important that they are seen once by a neurologist to make a diagnosis, to see whether anything which is curative can be cured.
But basically, this could be detected to some extent by their own relatives if they are staying with them. But nowadays, parents and old people, they are alone and there is nobody to take care of them sometimes.
Correct. So, it is definitely can be, but you need to be, as I said, closely associated to see, because see on the face, if you ask how are you, I am fine, what have you done. So, sometimes you know the people will just say the same questions and they have the answers prepared.
See, Teresa, in Goa is, the health indicators are good. The life expectancy is also very high compared to the other parts of India. So, they live longer and many people are living lonely, alone. Their children are out of Goa. So, that's another reason. And we also look at hypertension, diabetes and all these other factors. A bad lifestyle, a bad diet, bad nutrition, smoking, drinking,
they say that
sedentary life.
These factors are
the
similar
same for all the lifestyle diseases.
Correct.
So, this is the first thing which is important. Now, you know, I have seen in my experience that it is more common in women. You also must be experiencing in your practice. Now, why women, they say, is because number one is that the woman at the menopause, there is no estrogen, gets less. So, estrogen protective against this. Second, frail, there are more connections in the brain. And so, these are some of the factors. A woman looks after the family first and herself afterwards. So, all these are...
This is the same in Goa
in Goa also.
We do see. We don't have
in women there are more.
We don't have statistics, but definitely we do see it more commonly in women than men. We do see men also with Alzheimer's.
We see men also,
But if you see the proportions, yes, women is more frequent.
And then it must have been there, but then it was not.
They also say,
Teresa, No, this is not something new.
No.
No. It
No.
has actually been even shown that there is a tendency that women have it more often, but it is also very much very frequently seen in men.
Okay.
Men also and women, but also another reason, women during pregnancy they have got say hypertension, etc., eclampsia, and also some genes which are carried on the X chromosome which the woman has. So these are some of the hypotheses which could be, but it is not that exclusively in women, it is seen in men also.
Like you have certain diseases which are like predominantly in women.
Yes.
You know, that will be, the ratios will be 9:1 or huge.
But
here
it
is not so
like
much.
that.
It will be like maybe about 1.5 to 1.
Slight
tendency towards.
So and is it genetic?
There are
10%.
genes. It's quite, most of them are non-genetic, idiopathic.
Is it?
Most. Only around 10% of patients there can be a genetic incidence. Now, when there is a genetic, there are certain genes which have been found, and it is seen that people who have a genetic form of Alzheimer's, usually it comes at a younger age. So they will start usually by around the 5th decade, or sometimes even in the 4th decade of life. The early signs can be seen in some individuals, and so it is seen earlier on, and they progress also a little more aggressively than the idiopathic form.
It is better when it is seen in younger to screen the family for this ApoE
gene. Yes.
It is better to screen, so because these people will be more chance of getting Alzheimer.
Yes.
As of now, there is no cure for this.
There is no cure. There are drugs which have been found.
Only control.
No, there are drugs which are found which help improve the brain function for some period of time, so that the person can have a more independent life for a longer period of time. But eventually they are not correcting the underlying process of amyloid deposition and the degeneration that is happening. It is only boosting up the chemical levels in the brain,
quality of life,
and improving the quality of life. Now, through research, they are finding agents where you can reduce the amyloid deposition in the brain. Now, here you need to start treatment very early. So it is very essential to do all these CSF tests to prove the disease, because these are drugs. These are drugs in the initial phases. They have already come at least around last 5 years. Various drugs have been coming up, but they have not proven to be as efficacious. So now the new ones which are coming out, and maybe in the coming year we might have one coming to India too.
Is it?
Yes. Those drugs are to be used in the initial stages. So it is very important to do these tests to confirm the type of dementia, and only in those patients it is planned that the drug may be initiated.
Because there is one school of thought, they say that if this could be found out early, maybe in 50s or 60s, then you could delay ultimately.
That's the plan, that's the whole idea. But how it functions, only time will tell.
Yes, but then you need experts.
We have
time will
tell, because how the drugs manifest, how they affect the person in other ways, also we have to see.
But then there's a lot of research that is
There's
ongoing.
A lot of research that is ongoing.
And do you think eventually one fine day will be a cure for this?
We hope so. Let's see. Because it's a multifactorial disease, and many a times patients, as I was saying last time, they don't have only one disease. There are patients whom we can say this is a classical case of Alzheimer's. But many patients have got Alzheimer's plus vascular dementia.
Because they say that if you have had episodes of stroke, heart attack, high blood pressure, diabetes also, and amyloid, earlier there was one school of thought, they said this is diabetes type 3 or 4.
Type 3.
Is there any connection with sugar?
Yes, so Alzheimer's patients also have a higher incidence of diabetes in Alzheimer's dementia. Secondly is that we have seen that whenever a sugar is uncontrolled, we find that the patients worsen much faster cognitively.
I think insulin resistance is also an issue.
It is thought to be.
Glucose, insulin resistance in the brain. That's why type 3 diabetes.
Yeah, that's what they talked about.
It's talked about.
Yes, it is talked about. And
now, you have so many patients, some early stages, some later. Now, those who come later stages, nothing much can be done. They have to be looked at caretakers at home or in a in their own house or in some institution. So this is another thing which which is socially and economically important.
Yes.
Which I thought, and a very good model, as Mr. Jovito said last time, that in the old days there were no labs in the villages. Today there are laboratories in every village. Similarly, maybe after 30 years, 40 years, the number of cases increase. There will be these daycare centers and other centers for palliative centers for these patients, and a very good model for these patients may be in all villages. At the
Yes.
moment we don't have that many in Goa, very few. I wrote about it in palliative care,
Yes.
Mr.
I
Jogi.
remember. I
Now,
read it.
there's a very good model given from Bandra, Bombay, by Dr. Armida Fernandez. Dr. Armida Fernandez was the dean of SIAN, Lokmanya
Yes.
Tilak Medical College. She retired 2001 and she has set up a NGO. Now, her NGO she has got different types of people and different types of patients. Patients could be cancer, terminal cancer, could be dementia, stroke, those are terminally ill.
Yes.
And she has got a doctor, she has got nurses, she has got counselor, and she has got physiotherapist who will look at them if they can't come in their houses alternately, and also she will see they come to her OPD. So it is a very good model which will help in
Yes.
the palliative care, and if Goa follows this model in different places, it's surely going to help the patients. And of course there is Dilasa which admits patients. There is in the Sipla Foundation in Margaon, Auspicio. But by the time I know of patients, Dr. Teresa, the home for the aged do not take the full-blown Alzheimer's, because the things are different, legal things, how they behave, they cannot understand. So this is the
And they need individual care also.
yeah.
They need individual
They
care.
need individual care, and which is
Yes,
costly.
which
and
is costly.
Once such a patient is identified at your level,
Yes.
then how do you go about?
So when a patient comes to us, either sometimes they may come very early in the disease, very early. Sometimes the individuals come by themselves very early. So first we do a detailed history is what can guide you the best. A proper history from a person from a relative and from the patient who is observant is the best guide in your diagnosis. This is supported by a detailed neurological examination, and this neurological examination is done along with certain cognitive tests. We do a battery of cognitive tests where we are basically checking how each of the lobes of the brain is functioning, and we do those tests, and then following this we will request for a lot of investigations. Some investigations, basically we are looking for blood in biomarkers of all the problems which can recover, from the patient can recover. Suppose a person is suffering from a reversible cause of dementia. So we do all those tests, and we will ask for an imaging, an MRI. Most of the time we ask for an MRI. Sometimes for people who are advanced, they cannot stay in an MRI, they are restless, they cannot go inside the MRI, we do a CT scan. As I mentioned earlier, we have to know the cause, and we have to be sure that we are dealing with something which is non-reversible. Now, once the diagnosis is made, at the moment the treatment is in the stage 1, what we say, to even stage 2, mid stage 2, we prescribe certain groups of drugs which are called acetylcholine esterase inhibitors. They increase the levels of certain chemicals in the brain which go down in Alzheimer's dementia. So they are beneficial in Alzheimer's dementia. They may not be beneficial in all types of dementias. So sometimes we do use them even in vascular dementias where they can benefit to a certain extent. So this helps patients to be a little bit more attentive, more oriented to the day. Otherwise the patient's attention just keeps flitting, and then they are very confused. So we find that patients do better for at least a period of 2 to 3 years. They have a better quality of life, more independent life, and then of course the disease catches up, and then they tend to decline. Now once you reach stage 2, already some help is needed, not in doing day-to-day activities. In day-to-day activities, a person remains independent till late stage 2, but in getting the activities of mental stimulation, which are very important to maintain cognitive function, in helping a person plan their day, in getting things done, because a person sometimes can be so confused that he may just sit the whole day. He may just get up in the morning and sit, forget to brush, doesn't have a bath, and then that all itself, that whole environment leads to a further decline. So, that is stage 2, and by stage 3 definitely the person needs help and may need help even in doing certain activities. So, usually late stage 2 to stage 3 we may not even start these medications which are this, because they may not make a difference, and sometimes all these medications can have certain side effects. So, we have to think individually about each patient and accordingly prescribe. So, this is what is followed at the moment, and as we said last time, always encourage patients physical activity, mental stimulation, a good diet and good sleep. These are important to be started from day 1, from the time of, even if you are suspecting, always encourage people to follow these practices to see that the decline is slower.
Teresa, actually I would recommend that all these good practices should not wait at a old age.
So.
They have to start from young age. No,
we have to start them.
We have to start from young age.
From our children,
the
we
diet,
have to start inculcating.
The nutrition, exercise, sleep, peace, water, and which we are discussing all the time. So, you are very right. But when the patients reach that third stage and higher stage, then it's still the responsibility of the society to look after them.
Yes, definitely.
So, that is what, so it is not only the government, NGOs, the family, and you know Mr. Jovito is a very renowned sports journalist as well as
yes,
educator of Red Cross, etc. I was telling him that it's a whole teamwork.
Absolutely.
It's not only one department. Team means doctors, nurses, technicians, servants, family, friends, well-wishers. I know this system. So like a football team, you need all to score the goal.
Teresa wants to add
it would be good, like what Dr. Wiseman is saying, that each village, each area have start with a daycare center. Give them at least by the daycare center where you can have activities for the patients, including a physical activity session, some engagement, and also give that family member a break, because the family member many a times is a spouse of the same age, and that amount of stress of having to live with a person with dementia is sufficient to put that individual under so much of stress, and finally get that person to fall sick. So, there are so many other things that individual has to do. He has to take care of the house, and everybody does not have the same financial capacities to employ people. So, we definitely need a daycare center first. Then of course, there are so many other individuals who don't have family members.
Correct.
So, living
the
individually,
family is out of Goa, abroad. Or
so, living individually is sometimes just going to add.
Exactly.
So, the next step would be to have centers where you know these people can move in. I don't know exactly how to make it financially feasible for every strata, but I think there is a way.
Centers will come up. I think.
Another way which I found very also interesting is this needn't be only for patients of dementia, but for senior citizens. Like in the Western world, they have a system of wherein the social services provides meals. So, they come, if a person is attached to the social services, they will provide come to their house and provide a meal for the person. They will have nurses who will come in and check on the individuals, even who are living alone, elderly individuals.
Absolutely. See, just to interrupt you, the Panjim parish as well as Bandra, which sometimes there are people from the parish council which go to old people's houses, check their pressure, check their, talk to them, help them. Similarly, Panjim also I have seen. Panjim parish,
Yes.
as well as I've seen at in Bandra in Bombay. So probably it will, as the
There
awareness
are-
is created,
yeah.
it will increase.
I know that the Red Cross in Portugal.
In
because
Portugal.
I have some friends
Yeah, yeah.
in down south
Yeah,
in Algarve.
Algarve. Yeah.
Both are not in a position to move,
To
cook
move,
their
yeah.
meals.
Yeah, yeah.
Red Cross provides them the meals.
Provides
What
them,
you-
yeah.
yeah.
So-
And also somebody who remarked to say that our people in the olden good days,
Yeah,
golden
yeah.
days, used to live in houses which were independent.
Correct.
And they had open space,
Yeah,
so
yeah.
they could walk around, move around, and they would do a lot of gardening.
Yeah, yeah.
And
Activity.
and they would go to the places of worship,
Worship.
walking, rather than now everybody, they say, you see now cars and pool of car, everybody prefer. Whereas in the olden days, what you talked about exercise,
Correct.
it was being done.
I was just, I'm just telling two more points. These are two new things which are coming, more than that. One is pesticides, insecticides.
Yes.
The study is done in West Bengal that those farmers are getting dementia because of insecticide.
That's pollution,
pesticides.
no?
Yes.
And pollution. Pollution is also another. I think we are going to discuss pollution in more detail later on.
Yeah.
So just a few more points, Teresa. They say the keys, the mobiles, the wallet, purse of these people should be looked after in one particular place, etc. Second, the medication, drugs that they take should be.
Yes.
They should also, their finances are a problem. Somebody has to
Yes.
handle them. They go to a shop, they pay the money, they don't
They
know.
don't know how much of
how
change
much is
to
coming
take.
back. Then the mobiles should have recorded the telephone numbers of their family, so that if they are lost, and and in some houses there are alarm sensors. Those who are challenged,
Yes.
they may not hear, but they will hear some sort of their sensors. And the type of furniture you should be careful, and the mirrors which are there. Then another thing is that so as you rightly said last time, they should avoid a fall. So they usually take tablets to sleep, etc. That should be
Sleeping tablets are actually
is the
very
worst. Is the worst.
one of the worst
Yeah.
things for
Is the worst.
elderly
Yeah,
people.
yeah. One more thing I was just reading, and not only reading, I know people who have undergone bypass, cardiac bypass, some surgeries, etc. They can also undergo dementia.
Yes.
It is proved scientifically,
Cognitive,
evidence based,
yeah.
and I know of some of the people who have undergone a bypass long back, and they can undergo dementia and develop into Alzheimer's.
Yes.
Yeah, surgery, bypass, for head injury,
see,
tumor.
there are two things. One is even an elderly person, last time we were speaking, elderly person who is already, the brain is shrinking. Now, if that person is subjected to a severe insult to their body,
Correct.
either in the form of anything, it could be an infection, it could be a surgery, a major surgery, and worse even if in the surgery the patient has drops in blood pressures going down,
Correct.
infections,
Correct.
post surgery, all those
the multifactorial.
definitely take a toll on that
yeah.
person, and the person never reaches what the level where he was before he went in.
Correct.
So, so similarly in this bypass patients, these are the issues. So they are already
It's evidence based.
Yes, definitely.
It's not my own.
And
I've heard patients also who have told me this. Now, so anything else you
And
want to
second is during bypass also the chances of strokes
stroke
are higher.
because of the heart
because of
being,
the
bypass,
manipulation of the vessels and all
perfusion.
that. Yes.
Now, I've seen one thing. When a VVIP gets some disease, the whole world draws attention to that disease. And I think this came for the first time 94 when Ronald Reagan, the 40th president of America, developed. You
Yes.
must have been very young at that time.
Yes.
You must be knowing about
Yes,
it.
I know.
And then many actors, actresses, and even in India, many politicians.
Yeah, this disease doesn't spare anyone.
It doesn't spare
It
anyone,
doesn't
but
spare,
the coverage goes. See,
Yeah.
media coverage goes, and everybody looks at it as if. And
No,
more
but
research.
is it possible to identify people who are at a greater risk? Like you said, heart problems, stroke, diabetes, high blood pressure.
One family history.
One is if you have a very strong family history.
10%.
One.
Yeah.
Second is if you have all these lifestyle related
So
Bad,
it's
bad.
basically it's a lifestyle problem.
If you don't sleep properly.
See, Alzheimer's dementia, we don't know whether it is only lifestyle. Alzheimer's dementia. When you talk of only deposition of amyloid beta in the brain, a pure case of Alzheimer's. But as I told you, that many times patients have got two problems. They have got lifestyle related diseases plus Alzheimer's.
Correct.
Now
It's combination.
It's the combination.
Okay.
Now you can predict definitely if people have got Alzheimer, got
Right.
lifestyle related
Right.
diseases. You know that something or the other is going to happen
Yeah.
sooner or later, and it's
Yes.
going to happen
Yeah.
some years before. Then it
Yeah.
would actually happen.
Exactly.
They would have had a
Yeah.
maybe 10 years before their actual age of onset. They will start.
Correct. Correct.
So these are the ways of predicting. So a healthy lifestyle is one thing. Number one that all of us need to inculcate
Insist,
for
yeah.
in our lives, so
Yeah.
that we can avoid it.
Correct. And one more thing, no, Teresa and Mr. Jovito. See, everybody looks at disease which is single. For example, COVID, one virus, one looks at it. Where you see, these are slow, so they tend to neglect. They think they'll become better. So this is another.
And also the concept that it is age.
Yeah,
You know,
is.
it is
Age,
age.
age.
He's forgetting because of age.
Yeah,
Of age.
as you're
Until-
growing older,
Old,
it is a
old,
normal.
yeah.
Yeah, but
That
until
you forget the name.
yes, until you are the person manages by himself,
Exactly.
things are all right. Everybody
Yeah,
says
yeah,
it's
yeah.
age. When it starts becoming a
More.
burden on someone
Yeah,
else,
yeah.
that is when this.
Yeah,
But that time when that person is forgetting in the beginning and he's still independent, that is the time for intervention.
And very often I came a study to say that bilingual, use two languages.
Yes.
How far is that?
That is the
true?
same thing what last time we were talking.
We were talking
You-
neuroplasticity.
Yes. Always challenge your mind to learn new things. Language is one thing which is becomes more difficult for us to learn as we grow older.
Because now
Means,
they say
children
that,
learn very fast.
Yeah, now they say that Goans must learn to speak and talk in Hindi.
No,
because they are
no,
only anglicized in
no,
English.
what he's saying is correct. I gave a talk
Yeah.
in a school.
Yes.
It's a Raya school. And I just asked, what's the percentage? They said, doctor, you speak in English. Konkani, they won't understand. They talk English and Hindi.
Hindi.
Teachers will teach in Hindi.
Yes.
So, Hindi is a
So learning and speaking one more language, it will definitely
is beneficial.
help.
Yeah.
And we need to speak Konkani still.
Konkani, yeah. You know, I ask people when I go in Konkani, they reply to me in Hindi. Then I come to know from where the person is. Of course, there's very few who speak Portuguese.
Very now it's going down.
It's going down,
The
down.
number. And what is important, as Dr. Teresa
Teresa,
has
yeah.
said, you need to have day
Day,
care centers in every village almost
Yeah.
now.
Yes,
In every
because
village.
you can't have huge groups. They means they need individual engagement. Most of these people need a lot of engagement. So if they cannot manage in very huge groups, and they will all be at different stages of their illness.
Yes.
If you have someone with a stage 2, late stage 2, that person needs individual attention already. So you cannot have groups of beyond, I think, 15 people, or even where two individuals have to attend to them. So we have to have it at every village. Secondly, you can't have people traveling, the caretaker traveling and to the center, because they will spend so much time traveling and coming back. So there will be no respite for that caretaker, for the caregiver. There is no respite time.
We have to look after them also, because
Definitely.
it's a sad, caregiver.
That's what you have been
That
talking
I've been
about,
always
that
saying.
palliative care.
Yeah, we have to look after them also.
What they say now very often is whatever we have as of now,
Yeah.
they are very, very expensive.
Very costly. True.
Very
It is a very and many people can't afford it. It's
Yes.
very
Can't afford
it's
it.
expensive. It is
See,
the
there is a-
minimum costs of having
See,
a caregiver.
anything which comes initially is expensive, computers or drugs. Then slowly the cost will
You mean
go
to say
down.
the number has to increase?
No. The production. No. The this will increase. The awareness.
No,
the
but
number
the-
of caregivers.
But Dr. Wiseman, the human labor is something which is not going to get cheaper.
They are not.
It's not. They need a human engagement.
Human.
So
yeah. There has
you
to be a
need-
mission,
Yes.
or there has to be a, it's not only money which is the,
Yeah.
looking at. It's the other factors.
It's
Human.
the-
I
yeah.
agree with you.
So
There has
that-
to be from inside.
Yes. There has to be some
passion or
innate
service,
desire to do.
desire to do.
It
Correct.
is not like
It's not easy.
only, yeah.
But
And
today it's not done on voluntary basis at all.
No, no.
So
Today,
this
Mr.
is changing.
Jovito,
Go
see,
is changing.
not only God, the whole world,
whole world is changing.
is changing. When Dr. Shikovas was there,
Yes.
before, he was asking me to do autopsies of the brains, which we did. And you also got as many
Yes.
cases to do autopsy. But at that time till today, it has increased tremendously, the number of the Alzheimer. When the cases increase, there's always the number of the support, everything increases. The awareness, the support, like the villages, the panchayats, etc. must be not aware in the few years back.
Yes.
Today they will become more aware when they see around them. So that is what I am trying to say.
Yeah.
You got it. Otherwise, the home nurses used to bring from Kerala.
Yes.
At one time.
Mr.
Yes, yes.
Jovito will
From
tell.
Kottayam. actually.
From Kota,
Yeah.
from Kota, Kerala, there were 2 bureaus, one Porvorim, one South Goa. Now today, nurses are being trained and trained and trained.
It's
Home nurses.
become a very big business.
Very big business. So, what
at
I'm-
that time it was a mission.
mission. Yeah. So what I am trying to say is that as we advance, it will see the light of the day. That is our hope.
But I think you must be complimented for giving an exceptionally good services at the Goa Medical
Yeah.
College,
See,
along with your team, which is
Dr.
there.
Teresa is my student. So MBBS she did here, MD she did here also. General Med was very dedicated and intelligent also. And then she did a DM, the super specialization in PGI Chandigarh, which is postgraduate institute, which is one of the topmost institutes of the country for post graduation. AIMS is for MBBS and all this other All India Institute.
Yes.
I wrote about All India Institute yesterday.
I read.
Yeah.
And but PGI is
Is the-
for super speciality. And Teresa, I met Teresa in PGI. I came for a conference
Yes, I
many
remember.
years back. We were attending one, like a CPC in the morning,
Yes.
Fridays or something.
Every Friday morning.
Yeah, every Friday. I myself also attend. So anyway, she's doing a very good job. And the number of patients we refer to is tremendous.
I got several calls
Calls.
to say that she has been doing fantastic.
No, very, very
job.
good.
But we always see we need when it comes to dementia. I think this service we not only neurologists can provide. Because these patients need closer access. They
Yeah.
need something closer
It's
to
a
home.
team. Which is
It's a team where all the physicians, all the health center doctors.
Exactly.
We are trying to educate all the medical officers and all, get them used to how to
Exactly.
identify.
Yeah.
That's
and
nice.
and also this follow up, what I said about the blood pressure control, sugar control.
Correct.
This all can be done at the health
Yeah.
center.
I read that palliative care, besides in other health centers, Goa Medical College also
Yes.
some
yes.
unit is formed.
One unit is formed. Yeah.
So I hope it keeps on expanding and increasing. That is
Yes.
our hope.
Yeah,
And reaches the periphery.
Yes, what I have been told by a lot
Yeah.
of people
Yeah,
Yeah.
that you have been offering compassionate care
yeah.
and expert guidance to help
And
families.
dedicated.
Through this
And
journey.
expert means her diagnosis is very accurate.
And
that's very important.
one of them told me that she has been creating personalized plans to maintain joy, connection and purpose in daily life. May God bless you, Dr. Teresa.
Thank you.
And
But
So-
when every time you meet a family who has a dementia patient, and who is concerned about their dementia, it is something very touching, because it is not so commonly seen in today's day
Correct.
and age. Like the other day, just 2 days ago, I saw one family, they are not well to do, but the lady has been having dementia now. From what I get the history, she's been having it for at least 12 years.
12 years.
12 years. And the lady now doesn't talk. She's already having difficulty walking. In spite of their poor, they may not be very well educated. They economically the situation must be difficult. But in spite of that, they have the care, the love, the time. whatever is in their capacity, they give.
They do.
So that is one thing which is very touching when you deal with families.
Dementia.
So you have to make their life a little bit
Happier.
a little happier, give them something to.
Yeah, so there is a terminal patient of dementia. He becomes mute. He develops infection, bed sores. That is the end.
Yeah, so they
there's
have
a
difficulty walking. They
difficult-
become
yes, he is
slow.
almost
They have
bedridden,
falls.
bedridden.
Then they become very rigid.
Yeah, rigid, mobile, immobile. Now there's one more thing. Must be a lot of legal problems
Yes.
in their will, signature, etc., which I don't have. But as the society changes, this also has to be taken into account. The legal issues of a
Yes,
dementia
so-
or a Alzheimer's legal issues.
Yes. So when we make a diagnosis of dementia, and of course not in the first visit, but maybe because it is always advisable to see a patient on 2 or 3 occasions over a period of time
To be
before
sure.
you have very sure about the diagnosis of which type of dementia, and how the patient is going to head. Now, once you know that, and the person, especially when they are in their stage 1, when they have their reasoning abilities intact, is to speak to the patient, speak to the spouse or the family member who is close and who is going to help the individual, and make a plan. So, if the person wants to make a will, the person makes a will. If the person and not wait for the moment when the person is incapacitated and is at the mercy of others. So, at that time is to make the will, transfer, help the like the spouse to transfer the accounts on a joint so that accounts don't go are not blocked,
Yeah.
and help them to plan this before in this
So there are
stage.
also legal
Legal, not only social, legal issues,
Yes,
which
because
is a very important thing in today's modern world.
Yes, it is.
In today's modern world, it is
Modern
very
world.
complicated.
It's very complicated.
Very complicated,
Yeah.
because there are a lot of people who
Lot
take
of issues.
advantage of the situation.
Take advantage.
And family feuds, we all know that are
it's
becoming
best not discussed,
more and
but
more
it is very common. You can see it. Yeah.
Yes.
Thank you, Dr. Teresa. And may God bless
Yes.
you. You are an angel for
Thank you.
so many people who have
Thank you.
told
Thank you,
me.
sir.
And Dr. Wiseman, you
No.
excel
you.
in whatever you
Muito
are
obrigado.
doing.
Ani
And
Deus bem koru.
we will
Thank
meet.
you,
sir.
Yeah. We will meet because there are a lot of questions
Yeah.
coming.
As
And
it.
we'll open a new
Sure.
slot for
Sure.
answering
Yes,
the question
Yeah.
through your expertise. Thank you very much,
Thank you,
Dr.
sir.
Teresa and Dr.
Thank you.
Wiseman.